Why didn't anybody tell me? Did you guys know? Well, I didn't know. Stick around and watch this video because I'm going to let you know on some things I wish I would have known before becoming a nurse. But that's okay. Just stick around to the end of the video and I'm going to let you guys all in on what's the real deal to be a nurse. Some things you must know before entering nursing. This is a career that is very costly to get into, and it's very timely and it takes a lot of dedication. So I wouldn't want anybody to go through something of what most nurses did, including myself on some things. Even though I have no regrets in becoming a nurse, I still want to spread the word and let you guys know some things you really must consider before you take that leap in becoming a nurse. And just make sure that you're on the right path and this is something that you truly want to do. So for starters, the scheduling. Everyone always knows that a lot of nurses do 12-hour shifts, and that all sounds good and great because usually if you do 12-hour shifts, you're gonna meet your 40 hours or less work hours per that week. So you usually would do about 3 12-hour shifts or 4, depending on the accommodations that you have to meet for your job description and whatever unit you decide to work on. So with that being said, if you're working 3 hours, 3 shifts, 3 12-hour shifts back to back, it can be very grueling on the body, especially if you're into more of the physical, you're using a lot of your physical body mechanics just to do your daily operations for your tasks, right? So by the time you're off that 4th day, you're like wiped out. So that day doesn't even count as a day off because usually you're pretty exhausted and you're trying to catch up on the lack of sleep that you had pretty much during 12 hours, because by the time you get home, and if you have your own family life, you probably have to cook or clean, help take care of the kids, help them with their homework, whatever it may be, depending on your shift, of course. But either way, you're still gonna have your own responsibilities, or even going to your own doctor's appointment or getting your hair done, whatever some type of self-care things you're doing for yourself. So that is something to consider as well. It looks all good and great on paper and seeing all schedule and everything, but do you have to consider that most jobs in hospital settings are going to the 12-hour shift group as opposed to the 5 days a week, 8-hour shift, because it's a better handover in terms of the continuity of care as opposed to having more nurses switching shifts throughout the day rather than just having 2, because one does 12, another one comes in another 12, and then you're probably gonna have the same nurses do the same thing the next day. And also, one thing you have to consider is holidays. When you're an essential worker, you're going to be missing a lot of family holidays and functions because, as you know, when people are sick, there's no perfect time to be sick, and people are sick day and night, and holidays are not. If somebody's body is going through something, then it's going to be essential that you're at work, and doesn't necessarily mean that you're going to have a employer who's going to give you off Christmas because you have kids or you have your own family. Everyone has their own situation at home and everyone wants to celebrate holidays, but that's something as a nurse you do have to realize too, that you're going to be having to give up, and just because you work Christmas in 2020, don't think that you'll be off in 2021, right? Okay, so another thing is your skills, your nursing skills. You're going to be in school and you're going to learn all these great skills and how to do assessments and just different parts of the nursing aspect. But it's all good in theory and in your skills labs and clinicals. But when you get out to the floor, it's a whole new different world because you don't have anybody holding your hand. You don't have that clinical instructor, that professor, or heck, even your classmates where you guys are all trying to figure things out. When you're on to the floor, into the field by yourself, it's kind of like you're a deer stuck in headlights. I'm not gonna lie, it's scary, but you have to come with your A game. You have to be confident. You have to try to remember a lot of stuff that you just learned, and which is hard because you're never going to remember every single thing you learned in nursing school. It's kind of like the concept of if you don't use it, you lose it. So you have to constantly exercise your mind, constantly reading on articles on new things that's going on with the nursing world. And when you're working in the field, you're going to have confidence skills lab where they're always retraining you ever so a couple months, whether that's online or doing hands-on. So the educational department usually will have you covered, but for the most part, you have to have your own confidence and your own set of skills. Sometimes just having like a little notepad of like different lab normalities, or just different things to help you remember certain skills and nursing, and also have like a nurse handbook. And everything's so technology now. You could just look up a lot of stuff on certain websites online in order to figure something out. And don't be afraid to ask. Sometimes ask your coworker if you don't know, because you don't want to guess when you're on the floor. You're dealing with people's lives. Like, it's not something just to like wing at the moment. So that's another thing. Just be prepared. Like, you will be on your own. It's gonna feel like very scary and lonely, and that's okay. It's gonna, sometimes it's better to just be thrown in the fire that type of way, because it helps you build confidence and it helps you be more secure with yourself and to really know what you're doing. It just takes time. So don't be too hard on yourself when you're just starting out for the first year or even two. Some people get it within the first 3-6 months and they're like maneuvering, have their own schedule, have their own like routine, and they got it. But don't keep comparing yourself to those type of nurses, because it depends on your personality trait. But I believe confidence is something that you can gain over time in practice. Another thing is, don't believe the glitz and glam of nursing, where you think like you're not gonna get dirty, your scrub's gonna look as cute as you did when you walked in. And sometimes you can see on like Instagram, like there's memes of how I look before the shift. Like, you're all cute and like put together, and at the end of the shift, it's like you look like you went to World War III. It's funny, but it's true though, because if you walk in there looking with your hair all nice and tidy up, like nothing out of stray, and then you come out that way, I don't know what type of nursing y'all doing, because I don't see that too often at all. But realistically, you will come in smelling like Victoria's Secret, all types of your perfumes and hair all laid, and then you come out looking like, what happened to her? Like, she look a mess. But it's just because you was working hard. Like, you don't really have time to be in the bathroom. Like, you barely have time to go to the bathroom to handle your own business, let alone like being in the bathroom, fixing yourself, making yourself cute. It's just, it's not really possible. Well, anything's possible, but it's not really realistic or practical. So just be prepared. Like, when you go in there, like, you gotta prepare yourself for a battle, because most likely stuff's gonna go down, especially when you're working like an evening shift, when that sunset hits and you have patients who are getting sundowners, or just like sometimes like the dinner rush is usually when everything goes before you met pass. And don't think nursing is just the medical aspect. You're going to be doing holistic nursing in general. Holistic nursing in terms of you're helping, you're going to be like a psychologist, psychiatrist, a teacher, a therapist. You're going to be doing stuff that's like not so pretty, of you're been helping change people's diapers if they're in diapers. You've been helping with some spill that they had accident or urinal or bodily functions. You're been doing a blood splashing over the place. Sometimes even taking out the trash or cleaning up somebody's room, because sometimes you just, I'm not gonna lie, you're gonna feel like you're a maid. You're gonna feel like you're a waitress, because there's some patients who, you know, try not to bother you too much, and they'll just ask for like the basics and their medical care needs. And then there's some patients who think they're in a hotel. They think they're like the chateau or something, and they're like, oh, can I have a spritzer? I'm like, what's a spritzer? That cranberry juice you guys have in the fridge with a splash and ginger ale. Really good, by the way. They call well, some patients got me onto that. But some patients could be really, and like they could really test your patience, because they'll just keep having you back and forth, like you can't even get your medical work done because you know, they want you to get this, or they order some food, can you go downstairs? And it's hard to say no sometimes because some of them are dealing with a lot, but just be prepared. Like, you will be sometimes feel like a nanny or even a waitress. Those are some things.